relevance, the Minister highlighted, I mean, it cannot be denied. Building capacity for Africa to respond to pandemics, but more than that, also leveraging our investment in health innovation as a source for economic growth, and at the same time, using the strategy to further advance the objectives of building a renewed and a transformed system for science, technology, and innovation in South Africa. So over the past few years, and we will revisit this during lunchtime, there's been an enormous amount of valuable work done under the leadership of our former Director General, Dr. Majwaga and Dr. Masomi, to have a first phase of development of the strategy, which is now concluded. And today is a very important milestone because it marks the conclusion of this first phase and is the launching pad for the second phase, which, as the Minister announced, will culminate in a formal approval by our Cabinet. So what we will be doing this morning is to take stock of what the work which has been done, starting to look at the next steps for the way forward, but then very importantly also engage with all of you. So there's going to be an opportunity for questions and comments, because as we said in the opening session this morning, fully embracing the principles of open science and open innovation so that this strategy becomes a collective endeavor. The Minister did mention that the development of the VIMS strategy is firmly rooted within South Africa's decadal plan for science, technology, and innovation. And we're going to start by looking at that lens, the policy lens of why the development of VIMS is so crucial for the advancement of innovation in South Africa. And I'm going to ask Rakeshni to briefly speak to us on this, because this is the portfolio she's currently leading at the DSI. Rakeshni, please.
Thank you very much. Good day, Minister, Acting DG, esteemed guests. Today I'm going to talk to you about some of the efforts that are being managed within the department in terms of accelerating a sustainable regional vaccine manufacturing capability for the country, and some of the key strides that we are taking therein. So firstly, to say that in 2019, we had the white paper on science, technology, and innovation. And the department subsequently led what we call the decadal plan, which is the implementation framework for the white paper, science, technology, and innovation. And it's about deepening the knowledge economy for enhanced socioeconomic impact. Now, in summary, because it's a very long document, there are a number of grand challenges that are spoken of in the decadal plan, from climate change to future-proofing education and skills, reindustrializing the modern economy, and the future of society. We also have articulated new sources of growth, from the circular economy and the digital economy to identifying what we call STI priority areas. Energy innovation is one of them, and the other pillar is that of health innovation, which is wherein the vaccine manufacturing capability is anchored. So in terms of what is needed for a vibrant vaccine manufacturing capability, we're looking at supporting and strengthening our country's research, development, and innovation initiatives and capabilities to manufacture ingredients, vaccines, biopharmaceuticals, diagnostics, medical devices, all of which geared towards addressing the disease burden and ensuring security of supply. There's a number of key areas that needs to be addressed, and from the department's lens, this is what we're focusing on. Strengthening the regulatory authority, looking at drug discovery and delivery and development platforms, surveillance capabilities, establishing and ensuring we have the requisite world-class research infrastructure platforms, that human capital development and skills is anchored at the core of this initiative, that we are also exploring medical devices, diagnostics, and API manufacturing. So this is, in a nutshell, what the department is leading, largely through what we call the Strategic Health Innovation Portfolio led through the MRC. And we focus with a very small budget from the upstream end at the discovery and genomic surveillance, all the way to downstream, we're looking at clinical trials, research and development. And there are a number of key players, as you can see, from SAPRA to BioVac, APRISA, the SAMRC and the NICD, just to name a few. And of course, we have a number of universities that also have a role to play herein. Now, the vaccine manufacturing capabilities that we're looking at is anchored on 5 strategic pillars. Coordination and partnership, because we can't do this alone. So we're calling on a whole of government approach, as the Honourable Minister indicated earlier, and that requires us to work with different government departments, from Department of Health, DTIC, National Treasury, and pulling together some incentives for us to have a robust vaccine manufacturing capability and a vibrant vaccine industry in this country. The second one looks at financing, and this is where we are saying, let's look at some of the equitable partnerships and donors that we have out there to help us advance the strategic priorities linked to the vaccine innovation manufacturing strategy. Of course, we need an enabling environment for this to transpire, and this sets out policies and regulations, as well as the key enablers from infrastructure, as an example, all the way to making sure incentives are in place. And of course, this calls for education and skills and competitiveness so that we can penetrate the South African market as well as global markets in a cost-effective and efficient manner. So in terms of the vaccine development pipeline, what we're looking for is a robust healthcare system and an industry that supports this capability. So from discovery all the way to manufacturing and of course the regulatory capability, we're looking not just building innovation capacity and human capital for domestic vaccine manufacturing, and this will obviously link itself largely to our researcher cohort. But we're also looking at auxiliary capabilities and the push for making sure we have the artisans and technicians in place, for making sure that whatever vaccines we'll pull through, whether it's fill and finish, we have the necessary cold chain transport, logistics, the way in which we dispose and manage some of the vials and the devices that we're working. So what you're seeing here is creating a vibrant industry with spill-off effects in terms of job creation in other sectors. And of course, this also calls for developing entrepreneurial capabilities across the pipeline. So this is not just about vaccines, it's about creating a robust industry around the vaccine manufacturing capability. Of course, Minister spoke of this earlier, and we're talking about transforming our vicious cycles where we continuously claim we have a skills shortage and there's a high percentage of unemployment in the country, to moving to a more virtuous cycle. So we are looking at the skills, the high demand skills, and also attracting foreign direct investments to support this. As South Africa, we are plagued with an aging workforce. So the strides we take must ensure that we are ensuring a pipeline of capabilities of the next generation of skilled workers that actually feed into the pipeline and ready to take on some of the challenges herein. Of course, we're also making sure that we do have representation when we look at the skills compact in terms of ensuring that we do have the demographic representation, that gender is at the core, and of course, people with disabilities are also not left behind. Some of the key success factors herein is about making sure we have the right knowledge, attitudes and skills to drive the vaccine industry. It's about making sure that there is a learning environment in place. That once we have the inbound technology, we have the skills and capabilities to take us forward. It's not just about inbound technology and then not having the training, requisite training to utilize it, or the infrastructure platforms for us to upscale some of that. And of course, we're strongly advocating and pushing for the validity and ethical usage of the participants' data, and of course, data management in this regard. So in terms of summarizing what we'd find from the department's lens in sustaining a viable domestic vaccine manufacturing capability, the first one is about strengthening our coordination across all of government, building incentives and developing local, regional, and continental capacity and capabilities. The second looks at skilling. And that looks at developing, training, skilling, reskilling, and upskilling human capital development that goes beyond the university sector and also looks at the post-schooling education and training sector, given the industries I've outlined earlier. The third one is about strengthening our enabling environment, from facilitating access to financing, tech transfer, and mutually beneficial partnerships. And that largely links to how we manage IP and how we co-create and co-design intellectual property for the benefit of our people and that of the continent. Of course, investing in establishment of large-scale and feeder research infrastructure platforms that has geographical spread and representativity. And of course, finally, looking at ensuring a security of equitable supply, access, and distribution. And this will hopefully align ourselves to the Africa Union push for us by 2040 to locally manufacture 60% of the vaccine doses on the continent. Thank you, Chair.
Thank you very much, Rakesni, for sketching the policy context. As I've said, a lot of work has been done over the past few years, and in that policy context, and that's been work which has been largely been led by Dr. Musomi. So I'm therefore delighted to invite him now to speak to us on the work done, identifying the technology projects, platforms, and key catalytic projects which are going to be proposed as the building blocks for the further development of VIMS. Dr. Musomi, please.
Switch for you.
Mm-hmm. I think it's me.
Trust me to get the times wrong. I thought I was after Rachel. Good morning, everybody, or good afternoon. I've been asked to provide some insights into the choice of technology platforms or the rationale for using technology platforms as a strategic anchor for this vaccine work. I think I was still trying to fish for a quote from Thomas Kuhn. He wrote a very interesting book in the early 60s, which was The Structure of Scientific Revolutions. And I think it's important for us because in that book, he argues that when you've established something that is akin to a technology platform, but in science it would be a paradigm, it monopolizes and cannibalizes all resources, and it creates tensions within a system. And so the choice of technology platforms have to be chosen within the context of where we are as Global South, in a manner that will promote industrialization or re-industrialization of the health economy of this continent and of this country. I think the next slides will explain what we mean by that. I don't know how, do I use the slides here? Oh, the green button. Okay, so the 4 platforms that you see here, mRNA, VLP, inactivated pathogen, as well as the subunits. These are the commonly used vaccine technology platforms globally. There are more, but we've chosen the 4 because they represent the best possibility of success in what we're trying to do. And I must very quickly add that South Africa is in a fortunate position that we have one of the most advanced or the most resourced EPI programs in the developing world. What that does immediately, it provides the incentive as well as the financial or investment rationale for investing in this. Unfortunately, having this EPI well resourced by the government as a result of healthcare and the right of every baby born in this country to be vaccinated means you create a strong economic incentive. However, that has been turned on its head. We've put this slide as a way of showing the EPI vaccines, but the column on the left-hand side gives you a sense, in the first box, gives you a sense of the year in which each one of those vaccines was developed. And as you can see, there are vaccines that were developed in the 30s. These are vaccines that were developed in this country. We're not talking about vaccines that were imported. They were developed in this country by what was then a robust vaccine development and manufacturing system. Over the time, as the globalization happened, we've started importing this. And obviously, with the vagaries of the exchange rate fluctuations, there are important implications, such as that the number of children that are going to be vaccinated are going to become more and more exposed to not being vaccinated because of the cost of to healthcare. And so the innovation strategy, as it was framed, was to, and I need to very quickly also indicate that the VIMS name, which the minister calls the white powder that was used back in the day, is important. It's a distinction between rushing to a vaccine manufacturing strategy, because a vaccine manufacturing strategy does not give you the security. It does not stop the current paradigm of the imbalances between the global north and the global south. So we deliberately made it an innovation and manufacturing strategy to put to make sure that the innovation is linked to the research and development agenda of the country and of the continent. And as you know, that a lot of the diseases or a lot of the pathogens that are endemic in the African continent, no one's looking after them. There will be others other than Ebola. I like to mention the HIV, which I see my old boss is here, who's been working on it for more than half his life. And Professor Salim Abdul Karim. And that with COVID, one of the most astonishing things that we saw was that you had about 200-300 vaccine candidates within 3 years. And that talks to who COVID was affecting. It talks to the agenda of the R&D for products that affect the global south. And the vaccine technology platforms, and I must say this, and I want to say it in public, you would see that inactivated and whole killed dominate the vaccines that we use in this country, despite the fact that we were told that we no longer manufacture them because they are out of, we import that technology as wholly packaged and we pay top dollar for it. It would be different if we were importing new technology platforms, but we still import the very same ones that were demobilized back in the days of globalization. I cannot see. So part of the strategy of the innovation is that if you want to reindustrialize, particularly the ones which are low-hanging fruit, you have to target the ones that we were able to do in the past, whose IP costs are low, such as the whole killed and the like, and that the argument that we have to use the cutting edge technologies no longer holds. It is not backed by any evidence. It is important to adopt newer technologies, such as the mRNA, such as the VLP even, for preparedness, but it's also important to always consider that the pace from which we're operating is limited. And that if we could circumvent this notion of spending and also of adopting what I call dogmas, that simply because the technology is new, it's superior. It is not superior. The clinicians that are in this room will tell you that the way, especially also the veterinarians, that if you were to look at a vaccine, whether it's animal vaccine or a human vaccine, at a level of the chemistry, it's the same vaccine. It's effectively the same vaccine, and we have to rethink the way we think about innovation. Now, in trying to transform the health economy, the vaccine strategy was an opportunity, and I think somebody said that we mustn't waste a crisis, that an opportunity that a crisis provides. The same technology or science base that gives rise to vaccines, which are biopharmaceuticals, they're just a subset of biopharmaceuticals, can be used for other biomolecules. We've mapped what can be done with the opportunity because government is committed to it. It's going to be spending resources to develop the strategy and implement it. But it's an opportunity to then invest in the entire biopharmaceutical space. Part of that requires infrastructure. The infrastructure, and I think a colleague is going to be speaking about the infrastructure. The only difference here is that as a country, we have to adopt a more developmental model where we create national champions, where we create platforms that can be used by the wider innovation ecosystem, as opposed to trying to do it by ourselves. At the beginning of COVID, one of the questions that was asked to our president was, and I think the minister mentioned that we have one of the most developed research and innovation system in the continent. Why was it that at the onset or in 2020, late 2020, we did not have a single vaccine in development? We're not talking about a vaccine that's been approved, a single vaccine in development with this much vaunted technology capability. And so this is what it's trying to address. It's not just addressing the vaccines, it's also addressing the entire biopharmaceutical space. One could go on about the fact that the non-communicable diseases such as metabolic syndrome, diabetes and the like, we are still struggling with serving the needs of patients with that, particularly in the public sector. As part of the work that we were doing, as I said, we adopted the technology platform model, and we looked at the capabilities within the country. So it's one thing to say we want to do this technology platform, whichever it is, you have to start with what you have. And as a result, the first initiative that we undertook was to do an audit of what capabilities. Luckily, there are 8 or less technology platforms available to do this. So you're working with a very limited subset. You can do an audit very, very quickly. As big as the system of innovation may look, it is quite easy or feasible to map where the pockets of capability, I'm not going to say excellence, of capability lie. And we're able to cluster these very, very quickly. And in clustering this, and this is important because the technologies are going to be developed by scientists and human beings. They are not going to be developed by simply doing technology transfer or partnerships. Even when you do those technology transfers, they're going to have to be done by individuals who have the skill. And in our analysis, the initial analysis, the technology platform that looked to have the most competence in the country was the VLP one. As you can see there, we found that in the audit, 52%, and I must put a disclaimer, 52% of those audited were able to handle the VLP technology. Luckily, the VLP technology can also be thought of as a more mature technology platform. And the second part is that it is also one of the commercially important ones, or rather the ones that cost the state a lot due to the global and the public health necessities of vaccinating girls against HPV. This is just a slide summarizing the institutions in terms of how they mapped with regards to the audit. So the audit allowed us to then move from there to craft a strategy that would be closer to being feasible. Nothing is guaranteed. You have to start from a position of these are the facts. And when you've done the facts, you plug it into a strategic framework. And those are the institutions in the country that mapped to each one of the platforms. And when we say we are taking on 4 platforms, we do not exclude others. We're just saying that with the limited paths that the country has, focus on what you can do. And what you can do is embedded in the intellectual capital that it was shown through that audit. This is the infrastructure planned, or that the government is raising resources for. Again, this infrastructure is technology platform agnostic. So it's an infrastructure that you can use for any vaccine technology platform. It's an infrastructure that you can use for antivirals and other types of health products. And it's an infrastructure that is fundamental to achieving health sovereignty. Some of the services that are required, these are services that are not unique to South Africa or Africa. So this is the underpinning industrial or business ecosystem for doing this. And that's why the talk of partnership is important to making this happen. And there are more of these service providers or suppliers into the vaccine innovation ecosystem, or rather the health economy ecosystem. The slide here is an interesting one because it captures the players that are in the system and that we hope to see in the system. Dr. Rakeshni indicated that the DSI plan includes a whole range of other inputs such as diagnostics and the like. However, because we're starting from a ground zero, we have to take into consideration the inclusion and the participation of startups. These are also going to require a lot of government support and a lot of partnerships. We have to think about the inclusion of SMMEs, particularly SMMEs that will promote inclusivity and that will promote equity in the economy. The VIMS catalytic project, as was mentioned, there are 4 catalytic projects. And again, one has to emphasize that a catalytic project, by definition, is simply a way of testing the hypothesis. It is not to say that we are saying hepatitis B has to be the one, or HPV, or Rift Valley fever, or RSV. It is the way of testing the hypothesis. And I just think I will just take a short detour, which is to say that with the catalytic project, we were also testing a model of inbound technology where, based on the value chain, we were able to secure licenses from global partners who had developed these technologies. So these were ready. These technologies were ready for deployment into preclinical, in some cases into clinical. And that allows the system to learn. It allows the system to then go back and choose other vaccines over a period of time. However, it does not mean that you do not reindustrialize, go back to the old technologies. As a final slide, this is just a summary of where we see the world in the short term, particularly around pandemic preparedness, that with the infrastructure that we've built or that we're hoping to build, you're going to start to see antivirals because they have to go through the same preclinical pathway and the like. And this may be easier to develop than long-term vaccines over the period. Diagnostics, diagnostics, we demonstrated during COVID when the doors shut, were slammed shut in our faces in terms of importing molecular diagnostics, that we needed to be on our own when the next pandemic happened so that we could do our own molecular diagnostics. And we had some success stories, particular with the small startups. And the next phase, which is the medium term, is to start looking into the vaccines that we import that are in the API program, because you have a set market, you have a secured market. And the injustice of it all is that government buys these vaccines and imports them, and government funds the R&D. And so government basically funds R&D, loses that somewhere, and goes and imports the same thing that our R&D should be producing. And so in the medium term, you want to put back those vaccines so that they are manufactured, they are developed and manufactured locally. And remember, development in this case, you are developing the same vaccine that's already in the clinic or in the market. However, you're developing it so that you can manufacture it here. Simply being able to develop is not enough. You have to develop the processes that will allow you to manufacture here. And that's where the CDMO that Dr. Chikwamba will speak about. And then in the long run, we will be looking at novel vaccines, and hopefully by then the system would have learned to develop vaccines, or rather would have relearned, because we used to have this capability back in the past, and it's a question of relearning it. Thank you.
Thank you very much, Dr. Musomi, for that fascinating overview and the work done. And we're going to come back to that during the lunchtime. The key element of your presentation and also that of Minister Nzimande was that VIMS is a strategy for Africa and by Africa. And again, we would like to thank all of those, Professor Salim Abdul Karim, but many others present here, leaders of the South African health innovation community who has contributed to the work thus far. And that's what we wanted to do now. We asked one of them, Dr. Rachel Chikwamba, from the Council for Scientific and Industrial Research, to just share with us a perspective from an actor, a participant in VIMS, on what the contributions can be, but also the requirements. Rachel, please.
Thank you very much. Hopefully they load my presentation in a minute. Thank you very much. Let me start by acknowledging our Minister of Science and Innovation, Minister Nzimande, the Acting Director General Dan, and then let me just stand on the protocol that is already observed. I want to talk about a perspective from the CSIR on the role of infrastructure in driving, in really being a catalyst for localization of vaccines, therapeutics, and treatments in South Africa and in the region. So if I may, I always start by really saying, what is the lens through which we see the world? It is the lens of the mandate of the CSIR, where we are an organization that is charged through an act of parliament with undertaking directed and particularly multidisciplinary research and technological innovation to foster in the national interest industrial and scientific development. I won't read it word for word, with the intent of improving the quality of life of people of the Republic and people by extension on our continent and humanity as such. So that's the lens through which we look at the world. So it is about industrial development. And as Minister said, it is not just about making a vaccine. It is about stimulating a bioeconomy, an industry that thrives in order for us to be able to sustainably make for ourselves these particular products through our own endeavors. So I've chose to linearize the value chain for vaccines, treatments, and therapeutics, really to contextualize the situation as we see it in South Africa. And in this case, it's linear, but we all know that it is cyclical and iterative and back and forth. But for the sake of the conversation now, we believe that South Africa is very strong as an ecosystem in early stage research, where we do the identification of lead molecules, the hit vaccines. We optimize these and we end up with a candidate molecular vaccine. Very strong in that. We are somewhat strong in the translational work. The clinical testing is very strong, but the preclinical work, we have capabilities there with formulation and some delivery systems. There is process development that we need to do more at GLP standards to drive the clinical development. Then, as the blue color fades, you will see that that's where our capabilities fade. I should have strengthened the regulatory there in the middle, not just because Tumi is there, but because we've become really, really very strong and recognized by the WHO as a country with a very strong and upcoming regulatory capability. But I want to focus on product development, where we have licensure, process development, regulatory approval, in manufacturing and formulation. And of course, the last stage being that accessing with packaging and warehousing and distribution. Where is the gap? That's the conversation that I want us to have. And we believe that there in the middle is the gap. The strong R&D that happens in South Africa, which Nhlanhla so ably said, we lose somewhere to then import the products that we package and distribute to ourselves and to other countries in the region. What is the gap comprised of? The gap is that absorptive capacity to enable local development and localization. And to us, it has got two parts. It is the gap in infrastructure and the gap in the relevant skills. Those two things combined with the strong R&D that I've spoken to provide a bridge to those translational capabilities that will allow us to make these products locally. And let me elaborate a little bit further. With respect to infrastructure, we really require strong infrastructure from R&D, sound research infrastructure, through analytics, through scale-ups, and through to production of clinical grade materials. This is something that we're lacking at the moment and something that we need to strengthen. Having such infrastructure along the value chain enables us to develop skills where we can then have skills that are just beyond the science and engineering, but also to include the science, the engineering, the integration, the techno-economics, so that we can make product cost effectively. That combination will enable us to generate products, perhaps that undergo clinical development and proceed to full-scale manufacture. But infrastructure and skills are at the core of what we need to put in place. Our perspective at the CSIR is one that looks at some of the models that we've tried and tested for a very long time. We've got capabilities at the CSIR to do quite a lot of directed basic research through to applied research, development of processes, scaling up, piloting, all the way through toll manufacturing. This we have done in simple biomanufacturing. And in fact, when you come to visit these facilities, they feel very industry-like. It's huge capacity, huge steel tanks for fermentation and other capabilities. And for us, these capabilities are core to what the system can leverage as we try to strengthen the capability to make vaccines locally. In fact, with the support of our Department of Science and Innovation, we were able to start working on some of the catalytic projects around HPV, Hep B, maybe RSV as well. But as well, I want to mention that because this infrastructure exists, we are able to do workforce development work with the support of the likes of the Bill and Melinda Gates Foundation, the DSI, and our colleagues from the GIZ and KFW. The idea is that when you have such infrastructure and you leverage and you build on it, you can anchor an ecosystem in the bioeconomy where enterprises and startups are important. This is something you mentioned, Tata, to then say, how can we leverage such infrastructure to then provide technical support to the startups, to provide business networks, access to skilled workforce, access to funding, access to markets, access to actual manufacturing. This is what we are able to do with the CSIR in a very rudimentary way. What is actually required, in my view, and in fact, maybe to progress this conversation further, we have received some support from the DSI to build these small-scale clean rooms, CGMP capabilities, to do the pull-through of products from the NSI to the clinic. By having these particular clean rooms, we are able to then say, whoever has a concept or a prototype that they believe is a tested molecule, we can then be able in future to generate clinical grade batches so that we see that pull through from research through clinical development and regulation all the way through full-scale manufacture. In the context of the conversations that we are having with VIMS, we are having this small infrastructure in place. It's going to be completed this September. We're going to engage with SAPRA to make sure that it is qualified for current good manufacturing practice readiness in the next year. What we believe the system needs, perhaps building on some of this concept, is what perhaps is known as a contract development and manufacturing organization, a CDMO, to strengthen the ecosystem to move R&D outputs into products and services on the market. CDMOs do cover the gap, providing the requisite skills and infrastructure to pull through products repeatedly. We've got companies that make products, and they are dedicated to making very particular products. What the ecosystem requires is a capability that can capture outputs of the innovation system and then be able to really formulate, manufacture at scale, be able to do the analytics, to support clinical trials and post-market support, to be able to really localize different technologies. We're talking about VLP technology right now, some of the things that we want to develop our own and localize. And lastly, really to do the skills development. If you don't have the infrastructure where the people come out of university, do see, touch and feel and exercise in practice, it is very difficult to teach them the skill so that they can go and drive an ecosystem that is thriving, that actually makes the vaccine. It is our hope that an investment as part of this strategy will be made into developing this particular capability locally, because we need this capability. The country as such, as an ecosystem, is doing very well in terms of emerging capabilities. The university is doing their part in RDI, companies coming up with preclinical testing and formulation. Regulation is becoming strong again, and we are beginning to see more parties play a part in GMP manufacture. Of course, there is the funding support that we are getting from our funding instruments, but the anchor of all these activities is sound infrastructure. Without sound infrastructure, that still requires strengthening. The building of that CDMO that I was talking about, building on the seeds that we have, we will not be able to get this particular system to thrive. Of course, the continent also is rising with respect to infrastructure that they are building, and we hope that this continues and we can continue to then be able to make product for ourselves and become strategically independent. Thank you for the opportunity.
Thank you very much, Dr. Shikwamba. When Minister Nzimande spoke, he contextualized the development of VIMS within our government's medium-term development plan, and that plan has 3 apex priorities. First is economic growth, creating employment, and we spoke about VIMS' relevance for that. Second is improving the quality of living of all South Africans, fighting poverty, and as the Minister mentioned, VIMS will play an important part of our capability for example, the national health insurance, but it's also a third objective, and that is to turn South Africa into a capable developmental and ethical state. And by that state, we mean the capabilities such as the CSIR and other public funded organizations. And also in that objective, VIMS will play a crucial role. It was stated several times this morning already, science knows no borders. The challenges we have to respond to, like pandemics knows no borders. But we know that, unfortunately, international cooperation is marred by its own inequalities and prejudice. And we're very fortunate in Africa, in the developing world, that there is a committed champion for advancing the excellence of science in Africa, and also for building capability in Africa. And certainly within the field of the biosciences, that champion is the International Center for Genetic Engineering and Biotechnology, which is headed by Professor Banks, who we are privileged to have with us. So, Professor Banks, if I could ask you for a brief reflection on, from your perspective, the strategic relevance for South Africa of a strategy such as VIMS, but also the opportunities you see for further collaboration with the ICGB, please.
Thank you so much, Dan. First of all, I'd really like to congratulate DSI and the government of South Africa in this VIMS strategy. I think it's a fantastic piece of work. I had the privilege to read some of the early versions, and I really think they have done a tremendous job. And particularly Rana Msomi, who's really been driving this together with Phil Majwara. I think it really has an amazing, offers amazing opportunities for vaccine production and independence, not only for South Africa, but for the whole of the African continent. I was asked to say a few words about the context in terms of international cooperation and its relevance globally. And I'll take the Honourable Minister's analogy of the swimming pool. Africa, if it can become self-sufficient in the development of its own therapeutics, its own vaccines, that has a global impact. We know that next pandemic is around the corner. If that happens to occur or initiate in Africa, if there's local surveillance capability, local diagnostic production capability, local vaccine production capability, then that can be stopped in its tracks. So it's extremely important from a global perspective. One of the things that Rakeshni mentioned in her presentation at the beginning was competitiveness and affordability. And this is something that is really, I think, desperate in the African continent. We have to make vaccines and therapeutics affordable. Now, ICGB is doing a lot of work to transfer technologies for biotherapeutics. One of my overriding aims when we do that, when we work with SMEs and small pharma for delivering those technologies, we really want to ensure that we're not creating a new Genentech. What we want to do is we ensure that a company has a social responsibility. And while, of course, they need to make sufficient revenue to maintain that production capability, they also need to make sure the local people can access it at a reasonable cost. And I think that is absolutely fundamental. And I think where governments are clearly going to have to put input into supporting some of these production activities, on the side, there should be the implicit understanding that when a company does develop that capability, they keep it at a price which is affordable. So I really think that is a key point. Now, coming back to international cooperation, we heard that it cannot be done in isolation, and that's true. That's fine. We have agencies like ourselves which can help with scaling up training, we can scale up with capabilities in production processes and so on and so forth. But also look to some of your other partners, countries that have been through this transition and have gone from essentially ground zero to having really now fully fledged vaccine production capabilities. And I think immediately of Brazil and India, where international collaboration with them within this sector, I think is really, really important. I'm just going to say a couple of words about my own area of interest, which is human papillomaviruses. We heard from several talks this morning that VLP production is something that is on the priority for South Africa to develop, and that is absolutely perfect. You know, we know that VLP vaccines for HPV are available, but they're not available in Africa, or they're not available in anything like they should be, and that it all comes down to cost. Now, Africa has probably the highest rates of cervical cancer anywhere in the world. And so what that means is tens of thousands of women are dying every year purely because a country cannot afford the vaccine. And I think that is utterly disgraceful. So I really, really do encourage South Africa and other partners on the African continent to really push hard on developing that VLP technology at a price that is affordable. I would also say, and this is to also highlight the Honourable Minister's comment, it has to be made Africa relevant. Don't simply copy what's gone before. When we think about the HPV vaccine, it's extremely good, it's extraordinarily efficient, but there are certain virus types that are more prevalent within Africa than in other parts of the world. And in the current vaccines, those viruses are not included. So really, when making those vaccines, think about the African context. Finally, I would say that once you've got to that, once you get to that point, the other thing with many of these vaccines is public awareness and public acceptance. And this is certainly true in certain communities on the African continent. So dovetailing all this high tech, the production capabilities and so on and so forth, you also need to be able to reach out to local populations to convince them of the benefit of vaccination. And then I'm going to finish by just a very brief comment that developing these technologies, getting the vaccine capability, you then need to deliver it. And that's where the regulatory aspects come in. And I really do make a plea to countries within Africa to really look at your regulatory processes, to really see how you can simplify and make the process more efficient and quicker so that the technologies that you do develop can really get to the people that need it. So thank you very much.
Thank you very much, Professor Banks. Ladies and gentlemen, before we break for lunch, we would also very much like to hear from you. As we said this morning, this is one of the objectives of BioAfrica, to provide a platform for engagement, for policymakers also to be sensitive and to be listening to you. So I would now like to open the floor and ask if there's anyone who has any questions for members of the panel, or if you would want to make a comment on the further development of VIMS, that would be most appreciated. I would take them and then ask the panel collectively to respond to that. So if you could just please raise your hand. I see one of my DSI colleagues, but I don't want to go to him first. So unfortunately, the lightning is in my eyes, but there's a lady sort of immediately who I recognize. I'll come to you, Ben. I've seen you. No, I think further towards the back, someone put up their hands. There, yes. And then it's also further hands at the back, and then Prof. Karim. And if I could ask, if you could be succinct, please. Yes, the lady there, please.
You have to answer all the questions.
If you could please also just introduce yourself. No. Could you pass to Prof. Karim, please? Ben, yeah. We'll start with him, because there's a bit of confusion here. And then we'll go to those at the back, please. Yeah.
Good morning. My name is Slim Abdul Karim. I'm from Caprisa and UKZN. I have a question for Rakeshni. I'm trying to grasp where are you placing the priorities in terms of your candidates? Are we going to focus principally on producing vaccines that are already part of EPI, in other words, known efficacious vaccines? Or are we prioritizing new products like Rift Valley fever and so on that may have pandemic potential in the future? Or how are you balancing those two competing demands? Thanks.
Thank you, Prof. Karim. If you could go to those right at the back, please. And there's yes, the lady there where you are now, please. Yes, that's what I wanted to get to. Thank you.
I am Dr. Adrienne Lusa, and I'm here representing a startup, a biotech startup that is actually working to contribute to antigen development. And specifically, one of the targets that we opted to start out with is actually the HPV vaccine. So I'm quite impressed and encouraged to see that this is also a priority in a national strategy in South Africa. So my question really is to the panel to find out what exactly the strategy is to support startups that want to contribute in innovation in this area. Thank you.
Thank you very much. And then there were other hands right at the back. Yeah, the gentleman there.
Okay. Hi, I'm Issa Suleiman from CSR. I noticed on the vaccine strategy presented so far, the primary focus is on vaccines for human health, with the exception of Rift, obviously. I just wanted to find out what's the plan for vaccines related to animal health and agriculture, and also for agriculture. Thank you.
Thank you. Very relevant question. If there's no one else in this block, we can go to my colleague.
Good morning, all. I am Ben Durham from the Department of Science and Innovation, and we will be leading the charge on this VIMS. So it's not a difficult question, but it's a resource question. VIMS is a comprehensive, and some may say kind of the Rolls-Royce model for developing vaccines in South Africa with the 4 different platforms. But we all know that we are severely financially constrained in the science system. And my question, and this is illustrated by Dr. Chikwamba pointing out that there are some gaps in the value chain that would need to be addressed. So my question is, how do we move forward in a constrained financial system, assuming that we don't have the resources to move ahead on all 4 fronts at the same time? Is there a plan for focusing on one or some aspects first, or how do we proceed from here? Because it would be great to move forward on all fronts, but at an operational level, I'm concerned that the resources are going to be limiting. Thank you.
Thank you, Ben. There's no one in this block. There's one hand more, and then we'll come to the hands here.
Okay. Thank you. Professor Baptiste Dungu, veterinarian and vaccinologist. In fact, my question is a follow-up on the one that has been asked on veterinary vaccine. In Africa and in South Africa, we have extensive capacity that covers all the gaps that were identified on the veterinary side. And there's both manufacturing, R&D, and even production capacity on the veterinary side with all the technology that have been identified. In other parts of the world, like in Turkey, for example, they did use veterinary manufacturers to produce COVID vaccine in a very short period of time because they have expertise. But in Africa, we tend not to include that capacity, yet we have it, it's there. That's the comment I wanted to make. Thank you.
Thank you very much. We are running out of time, so I would like to have the last group from this. Yes, there's a lady there at the back whose hand is up. And then lady here, and then there on the third. So we'll take the last 3, and then I'll ask the panel to respond. Yes. Please.
Yes, thank you. Claudia Aguirre from GIZ, German Technical Cooperation. Thank you very much for the presentations. We very much welcome this important milestone. We would be very interested in market shaping and ensuring a demand. I mean, South Africa has proved to be capable of producing vaccines already. And we have seen that the demand has sometimes not be ensured. So yeah, just curious to know if also ensuring a demand from neighboring countries and other African countries makes part of the strategy. Thanks.
Thank you. And then there at the back, and then we have one more. And then unfortunately we'd have to conclude. But of course, thank you to the Dr. Botumelo and the organizers. You have chosen vaccine innovation manufacturing as the theme for this year's convention. So the discussions can certainly and will continue beyond the session, please. Morena, I think, I'm not sure the microphone is working.
Oh, hi, can you hear me? Oh.
Yeah.
I'm Morena Makwana, I'm from BioVac, I'm the CEO of BioVac. Thank you for the presentation, it's very intriguing. I think we probably have more questions around it and would be very interested in engaging DSI around the strategy. So I think the first question is whether is an opportunity for industry to give input and where I'm going, and I think I'm not only talking on BioVac, but I mean, we have industry also in the room that can give input. And essentially for the past 2 years, Africa CDC has come up with various diseases and platforms in terms of what we can look at as African manufacturers possibly. And then of late, Gavi has also come up with a list of priorities in terms of what African manufacturers can be incentivized to do. So I think my question goes into to what extent is there a link? And if there's no link, that's fine, but we need to ensure, because as manufacturers, we want to manufacture products for South Africa, but South Africa is too small, and we need to ensure that whatever that we manufacture is cutting across. So I think the plead is to possibly engage industry so that we can just stretch the possibilities that were presented. Thank you.
Thank you very much, Morena. Unequivocally, yes. I mean, we see you as a crucial part of this engagement. Then our last comment, and apologies for those that we couldn't give a time.
Thank you. Thank you so much for the opportunity and for the presentations. Prof. Bang just kick off something in my mind. He made mention of the fact that when we are producing vaccines, we should have Africa in mind, which is the context. And this conference seems to be dwelling a lot on South Africa, yet it's mapped as African Bio Convention. So what is the collaboration that we're doing with other African countries that have manufacturing setups like Egypt? We have Dakar. The CSIR mentioned, noted them, but then this doesn't speak to it clearly as to the effect of the collaboration. Because for now, we're looking at the fill and finish, to me, is not for us, in the sense that it's an end to a means. You just produce exactly what the innovator has done, and then you cannot move forward. We need to be able to develop our antigen from end-to-end production. There are other innovators who are on the continent who are doing well. I'll mention Novartis Biotech, which is supposed to be located in Nigeria and the US, working with Merck and others who are doing very well. We've come on so many platforms, the VLP platform, and then VibroFast Fund that can do so many things. They've had fund from the African Bank, they started feasibility studies, and the work is progressing. Dakar is also progressing, and the others within the region of ECOWAS that are also progressing. But this collaboration is not there. It's good to start South African, like somebody mentioned, market. You cannot produce all for South Africa and think that you can get market, because definitely with your population, you can't be able to make it. You have to expand to the continent. And that is what I believe that Africa Cities is looking at. So there should be that linkage to know what everybody's doing. On the global map is there. Everybody knows this is one probably there, but how are you linking? How are you collaborating to make it more effective and not be work in isolation? Because we are aware of things that are happening. We are talking of finances. we are duplicating efforts. So many things are going on, and at the end of the day, we don't gain. So if Africa has to do something for ourselves, we need to put the little resources, the know-hows that we have, everything together on the same platform, and then look at how best we can work. Because for vaccines, it's so complex, and we need a lot of knowledge, and we have the knowledge on the continent. Thank you.
Thank you very much. I'd now like the panelists to comment on that briefly, holistically. You've heard all the views, and we'll follow the same sequence of the speakers. So Rakeshni, then Dr. Musomi, Rachel, and concluding with Professor Banks. I can deal with the funding issue. Rakeshni?
Thank you very much. I think some concerns relating to the prioritization of pathogens that are identified within VIMS. That's going to emanate through what we have established as an interdepartmental task team. And I see Khadija is here. So she sits in that team with us. So that is still yet to come through. Where we are now is we've got a baseline document, a document that's quite robust. And therefrom, we've identified pilot projects, which Dr. Msomi very eloquently calls catalytic projects. So once we have that technology demonstrated and we can roll it out, it then means that, yes, we have a solid basis for moving forward. Our engagements with a number of international funders, NIAID as an example recently, was around the same discourse around pathogen prioritization. We all know that Mpox is big, and that there are a number of regulatory delays for us to get access to vaccines on the continent. And we need, through this process, to start becoming agile in our approach to addressing some of the continental's biggest burdens. And in terms of our startup engagements, Morena, yes, we're going to start that process. And that won't just be with industries and startups, it will also be through universities as well, and science councils, national facilities, to also boost up the rigor of what it is we are selling, because it's going to be a whole of government. It's going to be an SA Inc. document, and we all need to rest assured that this is the hymn book from which we are singing. So a number of consultations are going to ensue here from. And finally, around our reach within Africa, Claudia just spoke, and she's helped us with a number of market shaping studies at the department. But one of the things that's critical is that she's also, through the GIZ support, started a number of training capabilities and sharing with us some of the major milestones, initiatives, infrastructure that is being set up across the continent. So yes, we can't do this alone. To meet that 60% domestic vaccine dose supply by 2040, we're going to have to be synergistic in our approach and complementary in our approach, and of course be in a stance where there is knowledge sharing, there is infrastructure support, there is skills development, and that will be a priority for us as we roll out VIMS. Thank you, Chair.
Thank you very much, Rakeshni. Dr. Musomi?
Apologies. Can I hear me?
Yes.
Does it work? I'm having trouble with technology today. I'll just answer maybe one or two questions. One was around the catalytic project. And I think this has to be emphasized in that they are chosen so that the system can learn, but also for the system to be able to produce these, I think Dr. Banks mentioned for HPV that the epitopes that are circulating here in this continent are different to the ones on which the design of the current vaccine is based. And so ultimately, it's not just about having security, it's also having better products that are more suited to our circulating variants. So that in the future, when we're able to use the VLP platform, for example, we're able to change as per the dominant strains or the dominant variants in our environment. That's the main thing. I think I made the point that don't take the 4 catalytic projects as the defining elements of the strategy. The defining element of the strategy is the technology platforms. And to very quickly move on to the technology platforms, we mentioned 4. Those technology platforms, mRNA is a newer one. It's going to be a journey of discovery, a lot of discovery science. There are also more mature technology platforms that we can reshore. So in other words, you are basically going back to the capabilities that you had in the past because they still work. It makes no sense to import when you can still, and I think it was Dr. Betty Dungu who mentioned that from a veterinary perspective, those whole killed and inactivated pathogen technology platforms are routinely used in our veterinary health sector. We have those capabilities, and it's a question of pivoting. Obviously, Tomi is there, she's looking at me and saying, you cannot just pivot, for the sake of pivoting. They would, within the regulatory framework and all of that. But I think the strategy has put in place elements that augur well for us to come together with private sector, the industry, as well as startups and SMEs, because that's the key to the future. It's known that large companies are not very good at re-entering themselves or repositioning themselves, particularly with newer technologies. So it has to be an entire ecosystem from startups, which are spun out of universities, to all the way to large corporations like BioVec and the like. And I think the last thing that I want to emphasize, because the question was asked about the rest of the continent. One presentation that was probably lost because it happened before the minister was the one by Dr. George Painter, I think it was, from Emory, because that is seeking to establish partnerships across the continent because certain pathogens are not endemic here in South Africa. So South Africa cannot be the be-all and end-all for the entire continent. As much as I understand that this is by Africa, I think it is important that you raise the issue that it's not by South Africa, it's by Africa. And the only way we can secure the sovereignty of this entire thing is to ensure that the West, the East, and Central Africa comes to the party as far as this is concerned. Thank you.
Thank you very much, Dr. Masomi. Rachel?
I think most of them have been answered. I'll touch on support to startups is one of the important ones. And I think one of the ways we can support startups is to make use of the infrastructure and skills and capabilities that already exist as a platform to support the startups with respect to advancing their own prototypes all the way to work packages on the basis of which they can have materials for clinical development and then decide whether they're going to proceed and bid to build their own infrastructure or contract other parties to help them to manufacture their product for them. But I think that availing that kind of infrastructure skills in an open access kind of way with the support of government and industry would go a very long way in ensuring that we don't all have to start from zero buying every basic thing. We can leverage what the system has already established. The last piece I want to touch on is the skills, if I may, Dan. We've been supported by our colleagues from GIZ and KFW, as well as the Gates Foundation, to put together skills and training courses for biomanufacturing. My colleagues who run with the program will talk about these programs later. And those programs are not just for South Africans. We have had cohorts that have come everywhere from Senegal, from Egypt, from Ethiopia, from all across Africa, which shows the Pan-African perspective of how we look at building capabilities on the continent. And lastly, of course, if we look at market shaping, I think it's important to mention regulatory harmonization as a key element in broadening the markets and making it worthwhile for manufacturers to manufacture locally. But secondly, also, really, I think we need to think about technologies that allow us to be scale appropriate, not to really go all out to make very large infrastructure that would require us to have global markets that are perhaps difficult for us to break into. Let me leave it there.
Thank you very much, Rachel. Any final reflections, Professor Banks?
I'll just say a couple of words on the international aspect and the issues that have been queried regarding cooperation in Africa and also market share. Absolutely, there has to be international cooperation in these activities. I think cooperation within Africa is absolutely fundamental. And I think it's very important that we don't reinvent the wheel in multiple places, and so that there is serious discussion amongst different stakeholders on the continent to ensure that there isn't undue duplication. I think a key element, as I mentioned previously, is the affordability. And so if it's affordable, I think market share is not going to be a major issue. Not in Africa, not with such a population that you have. And you know, if you do it well, why not beyond Africa? Look at India. You know, they're one of the major global vaccine manufacturers. There's nothing to say that Africa could not compete at that same level. So I would love to see vaccines being produced in Africa that could outcompete other parts of the world and become global products. So yeah, that's where I'd like to finish.
Thank you very much. And then the question of the funding. Now, I'm decided to answer this question, not because when I don't have the privilege of being the acting DG, I normally head the department's international cooperation program. So in theory, I should have the ability to give a diplomatic answer to a difficult question without actually answering it. But I'm not scared to respond to this question because we're aware. Both the two strategies the Minister spoke about, our country's medium-term development plan and in our own decadal plan for science, technology and innovation are very explicit. We are implementing these strategies, we're implementing these plans within an environment which is difficult. Very difficult from a funding perspective, huge pressures on the fiscus. And of course, this is across the science system. But that actually is the reason why we need a strategy. And I would say there's a 3P approach to how we're going to respond to this. And this is what a strategy informs. And the first, Ben, you said it. We have to prioritize. We know that. We're not going to be able to do anything at once. So we'll have to make those smart choices, those choices which give us the building blocks and on which we continue to build. And those will be choices, which is the commitment we make to you, because we are the Department of Knowledge, of evidence, science-based decision-making, which will be evidence-informed. And that's why we're also having this discussion. And as Rakeshni said, we will be having more of these engagements so that when we make those choices of the priorities, those are the right ones. Second P is just much better planning. And we know that, we accept that. There's huge inefficiency starting with us in government on how we plan public investment through different funding streams from our department, the DSI, our sister departments, health, trade, industry and competition, the Technology Innovation Agency, the IDC, etc., all which are funding agencies which can and will have a role to play to support the implementation of the strategy. So we know and there are measures in place, not only for vaccines, but for science and innovation as a whole, to enable us to create a coordinated and a strategic investment framework. So I have absolutely no doubt that with better planning and coordination, there's a significant amount of resources which can be leveraged. And also looking at some of the new innovative funding instruments which government is developing. Dr. Masomi's slide, in a sense, gave a little secret away. So if you're familiar with the government jargon, you would have seen something called BFI on a number of the slides. And that stands for Budget Facility for Infrastructure, which is a new funding instrument launched by our government to make those smart catalytic investments to enable growth. So those are all the options we are looking at. And then just my last P is all about partnership. Again, why we're having this engagement, it's partnership with industry and most certainly also with international partners, the development financing institutions, global multinationals, philanthropy, etc., who we all be looking to engage with on the basis of this strategy, which is an African-led, an African-owned strategy, but then to look for meaningful and strategic foreign funding and foreign investment. So I, at the beginning of my career, had a huge privilege, and that's a long time ago now, more than 20 years. Well, at least my beginning of my career in this area of work, because I'm much older than that. I had a privilege to be involved in the very genesis of South Africa's bid to host a square kilometer array. SKA, for those of you not from South Africa, may not know, this is the world's largest radio telescope, which is currently under construction in the Karoo desert of Van Oren Cape. And in the beginning, I mean, I remember that very same discussion, which people said, how can we afford this? I mean, there's no way we will have the resources, we will have the competencies, you are dreaming. I remember some very critical voices, including from the health sciences community, about why we're doing this. But more than 20 years later now, this is reality. There's a telescope functioning on African soil, built by African engineers with African data scientists working, and African scientists starting to produce the science which we absolutely have no doubt will be winning future Nobel Prizes. So yes, in difficult times, we are aware of it, but with ambition, and this is what we have here, ambition and then focus and strategic work, I have absolutely no doubt that decade, 2 decades, and hopefully much shorter from now, we will be looking at this strategy having that decisive impact, not only on science in South Africa, but also a decisive contribution for public health in Africa. So, dear colleagues, thank you very much for your time, for your input. This is, as we said, it's a wrapping up of a first phase. We're now going to start a next phase, and you will certainly be hearing much more from us through the different engagements and consultations. And in advance, I would like to thank you for that support. And let me also again thank the 4 panel members for their input. Thank you very much. I believe you will make the announcement on the lunch. Yeah, thanks.
Well done.
Thank you so much to our esteemed panel members. And for those of us who are chairing the sessions later on today, I think they've made our jobs really easy. In all the areas that you've touched on, we have breakaway sessions to speak to that. So thank you for that. So we're going to have to pivot a bit. And this reminds me of the times of COVID, where I remember we had authorized the AstraZeneca vaccine. And literally a week later, there was a new set of data. And we had to say, what are we going to do? So that's where we're sitting now. The minister needs to leave, but before he leaves, he wants to host us to a lunch where he's got some activities, and that must happen at 1. I am aware that we were meant to have a breakaway session at 12:30. So what we're going to do is we're going to have 3 breakaway sessions instead of 2. So there will be one that was supposed to take place around R&D to enable Africa's preparedness for the next pandemic, as well as global initiatives around One Health. We're going to combine those, and they will take place here. And I'll speak to the chairs, but I do think that the topics are aligned. And someone asked earlier around veterinary, etc., and we've now put this under One Health. So please do come into this room for that session. So there'll be one session here, and then we'll have then another session at 11 CD, that's the room. And that one will focus on, let me just have a look. It'll focus on, the theme is from fill and finish to end-to-end research and manufacturing. That will take place at 11 AB. That's the venue just outside of this meeting room. And then the third session will be on lobbying African governments around procurement, and that will be at 11 CD. That's the room. So we're going to have 3 sessions. So now we will be breaking for lunch, which will be hosted by the minister. We will be guided by the team. We need to get back then to these plenary sessions at 14 hours on the dot. We do have colleagues who are joining virtually, so let's respect their time and hopefully not run too late. So thank you so much, everyone, and thank you to our esteemed panel members.